webinar. Not seem necessary, but you do need to use a microphone in this room. We could, of course, hear you, but people on Zoom or watch some other point on YouTube won't be able to.
You got that one.
So would you be running the PowerPoint? I can't. Okay, so you would need to sign in? Yeah. So you go to our calendar page and you'd have to join as an attendee, and then I'll elevate you and I'll make you co-host. If you're joining us on Zoom, we're just taking a few minutes to let.
How many minutes? How you doing?
One day then. That's what I get for taking a day off. Get the whole weekend except for Saturday. Same stuff.
So there's not that.
No, we gotta have these in the park.
Yeah, well,
We've tried to have meetings in public places, so it's not perfect.
So just
People wanting to be jerks.
I didn't think
when we did that, it was before we were still on a digital recorder, we said that, so we didn't have hybrid meetings.
Come on, I'll give you.
Oh, okay. I wasn't looking at it.
No worries.
Gary, I see you are as well. I'm gonna make you a panelist. Okay, I'm gonna make you a panelist. And I'm the co-host for doing it.
Most of the people are in Zoom, like joining
virtually. So two of the people on Zoom are in this room.
Okay.
We're about even.
Women. Is Jacob here?
That is me.
Oh, that's you, Jacob.
I'm
Hey,
Jacob.
nice to meet you.
You do.
And Syed.
He's coming momentarily. He's coming in from,
Okay. Probably.
he's tagging around. Yeah.
Probably. And for joining us. Hello, everyone. Hello. Yeah. So we will begin our meeting today, and we will start with roll call.
Good evening, everyone. When I call your name, please acknowledge if you're joining us on Zoom. And I hear somebody else coming. If you are joining us on Zoom, please remember to unmute yourself, acknowledge your name, and then mute yourself again. Let's start with Jonathan Martinez.
Present.
You, Rosie Moda. Sylvia Augusto. Grisel Amador. Damian Andrade. Julia Bailey.
Present.
You, Julia, you do not count towards quorum. Joan Body. Esteban Chavez. Jamie Freed. Nicole Huang. Cynthia Jeffers.
Present.
Thank you. Cynthia, you do not count towards quorum. Barbara Lee. Marilyn Melman. Joanna Romero. Pat Ruiz. Kalina Sorma. Roll has been called. You do not have a quorum.
We should begin. I would like to start with Carrie. Would you like to take seat here so you feel more comfortable? Yes. Okay, take this one right here. And while you get ready, I will present you. Today we have Carrie Finnegan from Brooklyn Rise Charter School, which is dedicated to building the knowledge, habits, and mindsets necessary for academic success, ensuring all students from kindergarten through 8th grade are on the path to college. Their vision is rooted in the belief that every child should have access to a rigorous college environment, regardless of their economic status, zip code, race, family, education level, and home language. With that, you can start.
So much for inviting me today to speak about our school and our facility plans. I wasn't sure how many folks would have kind of the background about me and our school, so I was going to start there. I'll try to go through that quickly, and then, of course, present mostly about facility plans, and happy to answer any questions that anyone has. So I'm Carrie Finnegan. I'm the founder and head of school at Brooklyn Rise Charter School. I started my career as an educator as a sixth grade teacher in a traditional public school in Hartford, Connecticut, which is also where I'm from. I moved to New York to go to Teachers College to get my master's in education policy. At the time, I thought I wanted to get into the education nonprofit world. Took a job at an education nonprofit in the city doing school leader development work, specifically developing principal evaluation systems for school districts. Quickly realized that cubicle work life was not for me, and I really missed being in a school. So I went back into the classroom as a teacher. Um, I was certified in Connecticut, but not in New York. And so in order to get my teacher certification here, I'd have to get a second master's in teaching specifically, even though I had been teaching and certified in Connecticut. So all this to say, that kind of brought me into the charter world. I did work at a number of larger charter networks here in the city and didn't find a school that was really the right fit for me. And so after a period of time of kind of moving around to different schools, also moved to Boston, back to New York, then to DC, then back to New York again. I really wanted to like put my roots down. But I was nervous to go back into a school that wasn't the quite right fit. So I started working at a curriculum, a literacy curriculum company, training teachers in literacy curriculum. And one of my partner schools was here in Sunset Park, PS24. I worked with Maria Diaz, who's now the principal there. And I just really got to know a lot about Sunset Park at the time and really kind of fell in love with the community. This was 2017, so it was a different educational landscape, but at the time there was like a need for more elementary school seats in the community. And so that kind of got my wheels turning. And the original genesis of the charter movement was to provide neighborhoods with school options that weren't currently there. So that inspired me to apply to a fellowship program where I was able to spend a year studying schools across the country and learning how to write a charter application. I wrote our charter application. I actually was here at a lot of community board meetings before and during that time, trying to do a lot of community engagement in a variety of ways, just getting, feedback from folks in the community about our application and what they would like to see in a school. We were chartered in 2018. It was like a week after my first son was born, to open our school in 2019. So that's kind of me and the genesis of Rise. And then I'll just kind of jump into like where we are now. So again, as I mentioned, we opened in September of 2019. We are a slow growth model. So we opened with just kindergarten and first grade. This is now year 6 for us. So we're currently serving grades K through 6, which is really exciting. We started with just 90 kiddos and 15 staff members. Our original location was at 475 53rd Street here in Sunset Park, 53rd and 5th Avenue. We were right above the Rite Aid, right below the senior center, in 10,000 square foot, like postage stamp. I loved that space. However, we did outgrow it, and we'll get into a little bit more about our facility story, but ended up having to relocate to downtown Brooklyn at 9 Hanover Place, which is where we are now. But we are, and again, what brings us here tonight is talking about our future forever home, which is at 410 40th Street in Sunset Park. So again, we predominantly we're currently in the downtown Brooklyn area, but mostly still serving students from Sunset Park and more South Brooklyn. We have 320 students. We'll be 420 at full K-8. Again, we're a non-traditional public school. Our enrollment is open to all students at the grade levels that we're currently serving. We do have priorities in our enrollment lottery. So we give a priority to students whose home language is other than English, which means about 75% of our students come from homes where English is not the primary language spoken. 45% of our students are multilingual learners and receive multilingual learner services. We also give a priority in our lottery to students who qualify for free and reduced price lunch. And then every charter school within a school district has to give priority to their school district. So any students living within CSD 15, which is our school district, also receive priority. And then, of course, siblings. We do intentionally recruit for and seek to retain student populations that have historically been underserved by educational systems, such as students with disabilities, multilingual learners, and students from low socioeconomic backgrounds. So again, I kind of already went over this a little. Well, I guess I did the genesis story, and this is kind of after we opened. So again, our goal was to open a small school for families in Sunset Park that had smaller class sizes, an emphasis on small group instruction, and a commitment to providing strong learning for diverse learners. We opened in the fall of 2019, serving K through 1. I always tell people I like opened the school of my dreams in that fall. And then of course it was 2020, March 2020. So before we shut down though, 86% of our kindergarten students were reading on or above grade level. And our first grade students had made a 30% jump, going from 22% on grade level at the beginning of the year to 52% reading on grade level before we closed down in March. 2020, 2021 was the year of hybrid learning. So of course we had to do, some fully in person, some fully remote, and then some did a mix of both across that school year. We are extremely proud of how our school handled the pandemic, particularly the supports and resources we were able to provide to families during that very difficult time. Fast forward to 2022, which was year 3 for us. We opened back fully in person grades K through 3. However, that was the year we were only supposed to be in our temporary space for 2 years. So this was our 3rd year in that 10,000 square foot space. And so we actually had to under enroll and only enroll 1 kindergarten class that year because we didn't have room for our full program. So that was also our first year of state testing, and our kiddos outperformed city and state averages at 63% proficient in both math and reading. Which also put us on par with District 15 averages. Year 4 was the year we opened serving K through 4. However, we ran out of space at our Sunset Park location, and after not basically failing to find an as-of-right space in Sunset Park large enough for our school, we relocated to a school space in downtown Brooklyn. So that's 4 miles north from our original location. However, 85% of our families did choose to stay with our school, despite that significant distance and the busing that would be required. So we basically went from 1 school bus to 7 school buses, and we still maintain a commitment to bus all of our students who need it. Just pausing here, I guess, to give a little bit more context to the facility story. So we actually signed a lease for a building in District 20. However, the politics of charter schools and CST 20 is really challenging, and they essentially kind of the political powers that be organized against having a charter school. They are, I believe, the only CSD in New York City that does not have any charter schools. So unfortunately, that lease had to be broken since we weren't given the permission to basically switch from CSD 15 to CSD 20. Fun fact also, the OLPH building is technically we were on 53rd and 5th Avenue. I believe 55th and 5th Avenue is CSD 20. So we serve a lot of kiddos in that CSD, but we can't have a building there. We then tried to find a building in Sunset, but the zoning here can be really challenging for as-of-right schools. And so we did find a facility that was west of 3rd Avenue that we also went to lease on, and we attempted the zone change process, which is very costly and arduous and takes a long time. And after that lengthy process, we were ultimately rejected for a zone change for that space, and again had to break that lease. We then looked at a number of other buildings. I actually saw St. Rocco's was on for the other committee this month. Unfortunately, what's challenging for us is that we don't have any money to build a school, right? So we need a developer who's willing to basically invest the funds up front and build the school for us, and then they're basically just getting a long-term tenant in exchange for building us a building. So then also you need space that economically makes sense for that developer, and that has a lot to do with what spaces are zoned for. So as an example, there was another space we had identified that was east of 8th Avenue. It was on 9th, and it was very close to the subway at 9th and 39th. But the amount that the owner of that land wanted for the land made it economically, untenable, basically, to make a deal happen. So all this to say, it was a big journey, and that led us eventually to what we'll talk about later, which is our forever home. But we moved to downtown Brooklyn. Last year was our fully grown elementary school year 5, serving students K through 5. We also, every 5 years, charter schools have to go through a renewal process to basically be evaluated at a variety of ways to make sure they're doing their work effectively and basically honoring the commitments in their charters. We, after that process, received a full 5-year renewal, as well as permission to expand grade levels and become a K through 8. Transparently, I had only ever intended to open a K through 5 elementary school, but the families at our school really wanted the expansion to the middle school, and we try to be really responsive to families whenever we can. So that was kind of driving that decision. We also just have a lot of really strong teacher retention rates as well, which is, just a reflection of our school culture. And here, just showing, so one thing that NYSED does during the renewal process is they basically take schools and throughout all of New York State, not just New York City, and basically find what are called demographically comparable schools. So schools who serve similar student populations and are of a similar size. We did, in general, outperform in most areas. And the area that we didn't, which was our multilingual learners, for CSD 15 specifically, we have invested more resources to support our kiddos there as well. So charter commitments, as I mentioned, part of being a charter school is that the charter makes promises and a series of commitments. So one of our major commitments of our school is strong teaching. So with that, teachers get 15 days of professional development before the school year begins for curriculum internalization, anti-bias, anti-racist educator training, mission, vision alignment, and practice. Each teacher also gets a one-to-one coach that conducts at least weekly observations and coaching meetings. We provide 2 hours of teacher professional development weekly on Fridays. We also use a co-teaching model in grades K through 5 and have at least one special ed certified teacher at every grade level. We also have a high, I already mentioned this, retention rates, and we intentionally seek to hire and retain a diverse teaching staff that reflects the population of the students that we serve. One of our commitments is also, again, to provide a unique educational opportunity to the communities that we're in. So again, we cap our class sizes at 26, which before the class size reduction law was passed was more unique than I would say it currently is. But we have 2 classes. We only have 2 classes at every grade level. And again, we are a smaller school than most elementary schools, and our smaller student teacher ratio, because we have 2 teachers in every classroom, K through 5, is for like a 13-to-1 ratio. And it allows our schools to provide targeted instruction and supports for all students, especially diverse learners that benefit from additional intervention and support. We also emphasize culturally responsive instruction using culturally relevant curricula and pedagogy, as well as social emotional curriculum and learning using the responsive classroom approach, as well as we have a standalone SEL curriculum. We provide an robust enrichment program. Students get 2 45-minute blocks of enrichment every day, music, art, dance, and STEM. We've also invested considerable resources to create an inclusive learning department, which includes our director of inclusive learning, 2 special ed coordinators, 2 multilingual learner coordinators, 2 social workers, and 2 student support specialists. So that brings us to what, again, we were chartered and our school was designed to serve the Sunset Park community. That's where we originally were for our first 3 years, but we couldn't find an existing as of right building with which to house our school. As an example, like the school that Brooklyn Prospect is in, Sunset Yards, we had looked at that school extensively and had basically been told we wouldn't be able to get the zone change for it. They did, which is impressive. But at that point, basically, we decided we would have to find something that if it wasn't existing, we'd have to build it. And we did find a space on the corner of 4th Ave and 40th Street where the BP gas station formerly was. Their lease was up. And so the developer that we had been kind of looking, that had partnered with us, who has built like a number of charter schools across the city, mostly in Queens, he, reached out and said, could we sign a long-term lease agreement with them? And so that process takes quite a bit of time. We need approval from the authorizer, approval from the board, and we did get all those approvals in, and we basically signed a 35-year lease with them. Where the building is right now in process is that the environmental testing is happening. So all of that has been approved and it's in progress. It's not complete, but obviously hopefully it goes without saying that if anything in the environmental testing doesn't turn out right, then this whole deal falls apart and we can't build a school in a place that's not safe to build a school. So a little bit still holding our breath on that because we've been burned in a lot of facility situations thus far. So, but crossing our fingers that everything comes out safe and healthy and we're able to do that. I will say newer gas stations have a lot more regulations in terms of like how they have to contain things. So we are optimistic, but still waiting for those results to come in. April 15th, the commencement of the demolition of the gas station building began. I bike by there every day from here. I live in Sunset Park, so I bike now to downtown Brooklyn to go to work. And it looks like it's actually maybe complete, the demolition, but it's supposed to be fully complete by June 15th. And then August 15th, they'll complete the foundation. So once the completion of the demolition is done and the environmental testing is passed, then they can begin the process of doing the foundation over the summer. And they anticipate to finish the foundation in August, topping out the 4th floor by October. They say, and again, we always hold our breath when developers and construction timelines, but they say April 15th, the construction should be substantially completed with a target sign-off date of next June 15th, 2026. I will say that we are the location we're in downtown Brooklyn, we're not sure that this is like an ideal timeline. So we actually have an amendment signed for our current place to stay there if we have to for an additional year. And then I included the floor plans in my presentation, mostly for the board members to look through and ask any questions. I know for folks, you can't necessarily see. But it's essentially 4 stories, which is again, as of right for zoning there. It's a 10,000 square foot floor plate, so 4 stories, it gets us to about 40,000 square feet, give or take, because as you build up higher, it has to get, you lose some of the space. You'll see like the first floor, second floor, third floor, you start to see like the little cutaway here for mechanicals. And then the 4th floor, that again, you lose that space. And then there is going to be a rooftop play space, which is something that was like really important to us to have. We haven't in downtown Brooklyn and in our temporary spot in Sunset Park, we've never had a place for our kiddos to play. We've always had to go to nearby parks, which, you know, is fine, but we're excited to have that at our building. So I know that was a lot, but I'm happy to answer any questions.
Thank you so much. And I will open the floor for questions. And I would like to start with the first question. So you stated that usually the way you operate is from K to 5 and you expanded to K to 8. How do you got to that conclusion? Did you get any input from the community or like what was the process?
Yeah, so primarily I would say the feedback was from our like internal school community. Again, my idea was just to open one small standalone independent charter. I know sometimes in the charter world, for those of you that are familiar, there's sometimes networks that are looking to like expand and propagate at fast. That's like not us. We're just like an independent standalone school. But the families were really interested as we got on. You know, the middle school application process here in the city can be really stressful for kiddos and for families to navigate. And I think a lot of our families liked the idea of having a small school for their child to stay in through middle school before they applied for high school. So it was mostly from family feedback.
Also, you mentioned that you cap is 26 students per classroom. And I see that in the floor, like some rooms have the capacity for up to 33, 35 students. Are you planning to keep the cap at 26 or given the additional space that you have, are you planning to increase the size of the classrooms?
Great question, because with developers and architects, I would go back and forth on this a lot as to like what the proper size for a classroom space is. We emphasize small group instruction. So every elementary classroom has a large rug as well as 2 small U tables so that teachers can pull small groups and then the tables for the students. So I think any classroom less than 700 square feet is not adequate for that model. And so technically they think of things as like they want, what I've learned is like they call efficient use of space, which is just a coded developer word for small. And they technically, I think, only need 500, maybe 500 to 550 square feet is like the legal requirement for a classroom. But for kind of like our dream school, and since we were able to build this from scratch, I didn't want classes to be less than 700 square feet. But no, to answer your question more simply, 26, it will always be our cap. It's written into our charter, so we actually can't change it unless we wrote to the state and asked for a revision.
And what is the total capacity for the school? And do you plan for to accommodate any future growth?
Yeah, so we're currently, I believe, like the K through 8, we anticipate being, based on our current enrollment and our projections at 420. I do think technically we can enroll up to like 468 because it's whatever 52 times each grade level is. I can't do that math off the top of my head, but just based on our current enrollment, we anticipate being 420 at full growth.
Can you talk more about the roof? I noticed that there's like a bigger space, and I just like to know like what is the plan for this space?
Yeah. So another thing that's really challenging when you are trying to build a space as a charter school, if you're a traditional public school, who's building your building is the school construction authority, and they kind of own that process of both like siting buildings and building them. For us, because we're kind of at the whim of developers, another example of something that's very difficult to get a developer to build you is a gym, because it's not considered an efficient use of space. So you'll see on the first floor, like a very large multipurpose space, and the first floor of a building, the ceiling heights are a little higher. So again, it's by no means like a gym, but it is going to be able to be used as a multipurpose space. And then the idea being that we can use the multipurpose space as a gym space as well as the rooftop. So half of the roof will be just green turf to be used for physical education, and the other half will have like a playground, like playground equipment for our younger kiddos.
Want to ask a question? Go for it, go for it. We will not mind. I have a lot of questions, don't worry, so you can take one first. Go ahead. Oh, we actually.
Great.
Why don't you?
Sorry.
I can repeat it, or you can.
Go ahead.
Oh, he asked what the minimum age requirement is for kindergarten. So you have to turn 5 by January of that school year that you enroll. Yeah, so, and as part of the registration enrollment process, we do have to like look at the birth certificate to confirm that. But yeah, that's it. Otherwise, it's not hard to enroll, but that is, you have to turn 5 by January. The question was if you have to be zoned in the district. So charter schools are open enrollment, technically. So we can, theoretically, you could enroll a kiddo from the Bronx in our school. You can't be outside of New York City, like living in New Jersey, because then you'd have to bill New Jersey for the student. But as long as they're living in New York City, they can enroll. But as I had mentioned, we do have to give priority to students who live in District 15. So you can't give zip code priority. They won't let you do that. So we couldn't say 11220 or 11232. We can only say District 15.
All right. I just want some clarifications. In the floor, the plan, the floor plan, there's some abbreviations. I just want to make sure that I got them correct. What does the ICT stands for?
So even though we do a 2-teacher model K through 5, technically one classroom has to be an integrated co-teaching, which is what ICT stands for. So that's the one that has the special education teacher in it. Because ICT, integrated co-teaching, which is what is put on individualized education plans for students who receive special education services. It's just making sure that that child is in a setting that has a certified special educator. So again, we do 2 teachers in all of our classrooms, but only one classroom at each grade level would be like an official ICT room. We like to label it because if there's ever a difference in class size, square footage, we're always going to give the ICT classroom the larger room because there's often paraprofessionals working with students in those rooms as well.
Also, I see in the plan that there is like I think it's in the second floor, a label of special education with the total capacity of 14 students. Is this, it's only a single room that is available for?
Yeah. So that is for related services. So in addition to like on a student's IEP, they might have ICT, but they might also receive speech therapy or occupational therapy or physical therapy. And so we try to have spaces throughout the building that allow those related service providers to provide those services to students throughout the day. So if you see a smaller room labeled like special education services, that's what it's being used for, is like the pull-out services.
Do you know what is the capacity that the school will have to attend special student, like students with special needs? What would be the population number?
Yeah, so currently we serve 25% of our students have IEPs, which does put us on the higher end of the average in District 15, as well as, there's a number of schools here in Sunset Park that do serve around that same percentage, but that's something that the state looks at us and evaluates us for is recruiting and retaining students with IEPs. And beyond that, because we are a small school with a 2-teacher model across all classrooms, we just tend to attract more diverse learners and students with IEPs. So I would say there's no cap to the limit. The issue does become if a student has an individualized education plan where they need a smaller, more therapeutic setting, we don't offer any alternative settings other than ICT. So if a student, for instance, has 12 to 1-to-1 and they need to be in an even smaller setting, unfortunately, our school can't serve a student with that IEP. But other than that, we haven't really run into many situations where there is a student who comes to us that we're not able to serve their needs.
Also, I just want to dig more into the space. I know
Yeah.
you will have space available. Is this space will be available for the community for extracurriculum activities, or what is the plan, like after school?
Yes, I mean, that is like the dream. I will say it's been really challenging since we relocated to Sunset Park to downtown Brooklyn, but have maintained most of our population here in Sunset and South Brooklyn because it makes it hard to do after school programming. Students need to just basically get on the bus and go home at the end of the day because the DOE doesn't offer, they won't reimburse us for busing for after school activities. They only reimburse you for busing for the school day, which really limits our ability to do extracurriculars. One thing that we have done is we operate an after-school program here in Sunset Park that we bus students to, because that way families can still pick up more locally if they need to be picking up, after the school day ends. So we're really excited. One of the best parts about being back and more local to where most of our families are, we will continue to bus any students that we've, gained from being in downtown Brooklyn. We'll, of course, can do the same busing for them that we did for our Sunset families. But in general, we're definitely going to be more local at that point, which will allow us to do more extracurricular activities within the building. And as we have middle school, I think that becomes even more important. They want more opportunities for like after school sports and things like that. And then one of the benefits of being like basically just being the only tenant of this building is we're also going to be able to open up the space for other community things. So one dream we've always had is like offering our space up like for night classes, for adult learning and things like that, or on the weekends, like opening our space up to a community organization that might benefit from having, the large multi-purpose space. So that's a type of partnership that we're really excited about once we have a space where we can do that.
And I think that's a really important commitment that probably you should uh, think about when developing the curriculum for the community. Um, okay, so what is the long-term vision for the school, and how does the new building fit into this vision? Are there any plans for future expansion or additional programs?
No, definitely not K through 8, it's like I took this whole project, like the whole endeavor of kind of creating and opening a school. I take it, very seriously. I want to just make sure we just do this one thing really well. There's no big grand plans. It was just the idea of offering, another, like a small school option to the community. We're definitely not going to do high school. The economics, families will ask us about this. And again, we try to be responsive to families, but I'm very clear that there will be no high school. The economics of a small school high school is very challenging because when kiddos go to high school, they want more choice and elective classes and like AP classes, and you can't financially operate that with a small student population. So it's not going to happen. So K-8, 420 kiddos, Brooklyn Rise will stay. And there's nothing about our program that's going to change. Again, our charter is very clear as well.
There is also an issue that is often raised in this community, and that's the issue of traffic and enforcement of like police officers and things like that, crossing the streets and things like that. How do you plan to tackle this issue, which is really prevalent in this community?
Yeah. One thing that charter schools don't get to do is they don't get to block off street parking. So none of the neighbors have to worry about like that parking is still going to be very much for them. The only thing that will be difficult for neighbors, and this was true for us when we were on 53rd and 5th as well. I do think we made some lessons about how to be better neighbors in those situations, just in terms of being more communicative with the neighbors. I think initially just opening the school was such a stressful endeavor. I don't think we were being thoughtful enough about how to engage with the neighbors on our street to like communicate about like when are the hours that bus, and then we only had one bus too. So it was like not as, bad as it could be when we come back. We might have for a couple of years, we might have more busing as we're still bringing students from the downtown Brooklyn area here. With that was the decision. So as the gas station main entrance and the address for the gas station was on 4th Avenue. We did switch it to 40th Street to try to not, it's like we don't want to be blocking 4th Avenue traffic during rush hour. We see with all the construction that's been happening on 4th Avenue over the last few years that's wreaked havoc on people, going through 4th Avenue. So it is going to be our main entrance is on 40th Street. That's why the address of the school is going to be 410 40th Street. And I do, again, we learned a lot of lessons, and we're going to try to be really mindful neighbors of the busing there. And then other than that, there's not, again, our students will be mostly walking to school. Most of our families are pretty local or taking the city buses.
I think with that, that's all of my questions, and I'm gonna open for Jeremy and anyone else that has any other question.
Thank you. And there's at least one question in the chat. And I will invite anybody who wants to ask a question to use the raise hand function. I will ask the chat question in a moment, but I wanted to talk to you about one of your neighbors, the car wash that's next door. Have you had any conversations with them? Most of the day, of course, it won't be a problem, but during drop off and pickup, uh, there are a lot of vehicles that go in and out there. There's a lot of movement. Have you spoken to them about a security plan during those times?
Not yet, but it's definitely on our mind. I will say that our arrival, so one thing I didn't mention about our school is we are extended day. So we do, like, kiddos come at 8 a.m. So I'm pretty sure the hours of the gas station don't start until after that, but I would need to check on that. In the morning anyway, when I bike by, it's definitely not as busy as it will be in the afternoon during dismissal, because dismissal for us happens between like 4 and 4:30. And that is like a time where I feel like commuters are stopping and getting their car washed and things like that. So it's definitely, again, both being a good neighbor and, to your point, ensuring the safety of our students, and really thinking about encouraging our students and families to, when at all possible, use that 40th Street as like a thoroughfare to Fifth Avenue, and to cross the street if they need to, and trying to avoid walking past the car wash, because there are those curb cuts there, and the car wash is operational. We don't want to interrupt their operation, and we also want it to be safe for our students. So basically trying to orient families towards avoiding those areas. And then it might be the case, to your point, that we actually have to staff like a dismissal post and have someone there, either trying to ask families not to cross that area or to help guide them through safely. But we would definitely own the staffing of that, because crossing guards they're hard to come by, and they're mostly prioritized, understandably so, to DOE buildings.
You may also want to look into some sort of sidewalk barrier so vehicles can't, they're obviously going to be mounting the sidewalk to get in and out, but they hopefully will not be intruding on the space in front of the school. So you may want to consider adding some sort of sidewalk barrier there if DOT allows that. Susan Baxt has a couple of questions here in the chat. I will just read them. Susan, you could raise your hand, though, if you would rather ask them yourself. The first is, will you bus for grades 6 through 8?
That's a great question. We are currently, because we're still serving so many families far from our building, and we have so many siblings, right? We have students in 6th grade who have siblings in 2nd grade. But what is true is that we don't get reimbursed for students who lose bus eligibility. And so it just becomes more of a budgeting issue for us to budget for that cost. But it's one of these just frustrating things. You have the buses anyway. The buses have space. So of course we're not going to ask the middle schoolers to take the subway to school while their little sibling is on the bus. We're going to have them go together. So the answer is, for now, yes. Long term, it's going to, I guess, kind of depend on our enrollment and how local our families are. I do understand that middle school across the city is open enrollment. So students are more used to going to middle schools that might not be in the neighborhood that they live in. So I guess just time will tell, but we are really committed to busing as like an access and equity concept for our school.
And the second one I like, it's a philosophical question. Looking back at the project, are there a few big things that you would do differently?
A really good question. That's very deep. And yeah, I mean, I've learned a lot of lessons along the way. I mean, I'm a teacher by trade. First of all, not entrepreneurial by nature. So I just never really thought that I would open a school to begin with. And then it's been just a huge learning curve. I think the facility part of it is hard, because one thing I just want to name is, like, where we are locating our school is on kind of a school corridor, right? There's PS 516, there's PS 24. PS1 isn't that far away. We're right across the street from from the 2 middle schools, Dewey and Sunset Park Prep. And I don't ever want to seem disrespectful to a community, and especially to a community of schools, by locating so close by. But it was truly just the only space that became available. And so I do hope, so I guess that's not necessarily like something I have control over that I would do differently, but if I could wave a magic wand and site our school in a different location that made more sense just in terms of giving schools space, I would have definitely done that. No question about it. However, I'm, trying to approach it as like a positive mindset of how do we maybe create opportunities for partnership and collaboration with the schools that are on that corridor. I know that unfortunately charter schools and traditional public schools, there is kind of some natural divisiveness there. But I hope that maybe there's some opportunities for like positive collaboration in the future.
Pat Ruiz?
Hi, you already answered my question about collaborating with the schools that are surrounding, but I just wanted to mention that I remember you when you first came to the board, and I must commend you because you've really taken on something that you said you weren't going to do. So kudos to you and all the best, and thank you. Thank you very much.
I really appreciate that. Yeah, it's wild. When I first came in front of this board, I was pregnant with my first son. I just had my third child this last summer. So I now have, it's just funny to think about it that way too. Because I'm like, I had my first son the first year we opened. I had my second the year we moved to downtown Brooklyn. And then I just had my daughter when we opened the middle school. So it's been a journey for sure. But I just feel really, yeah, lucky. And this community is amazing. And even the criticism and the pushes I get, it's all good, and I just appreciate it as well.
All the best.
Any questions in the room? All right, so with that, we'll close this presentation. Thank you so much for coming to the board. And if our committees have any other, if our committees like transportation or any other relevant committees has any questions, I invite them to reach out to you, and we can schedule another presentation for them. Thank you so much. And with that, we will move to
Jonathan, a quick question. Will
Yes.
you be able to have the layout available for the board meeting as a handout?
is that possible to do?
Because you know the question's going to come up, so might as well.
All right, we can do that.
Thank you very much.
No problem. With that, we'll move with Jacob and Syed, and I invite both of you to take a seat, and I'll do the presentation. Hello, hello. Right, so let me introduce our presenters, which will discuss the No More Menthol campaign in New York City. This initiative aims to end the sale of menthol cigarettes, which disproportionately harm marginalized communities, and support a diverse coalition. The campaign advocates for legislation to remove all flavored tobacco products from the market, and this is an effort from the American Heart Association. With that, you can take the floor.
Hello, everyone. My name is Jake Zychik. I'm the Community Advocacy Director with the American Heart Association, focused on our public policy agenda to address cardiovascular health for all in New York City.
My name is Saeed Bouyan. I am a Senior Community Impact Director with the American Heart Association, and I primarily focus on our community and clinical partnerships in Brooklyn, Queens, and in the Bronx. And it's a pleasure to be here.
Agreed. This is our first time doing a presentation together, so we're going to get better over time. But we are representing the No More Menthols Coalition. It's an effort from public health and community organizations to restrict and end the sale of menthol cigarettes in the city. This slide here is just a little bit more about the work at the American Heart Association. We can make sure the community board and others receive our contact information, but really for over 100 years, we've been focused on addressing cardiovascular health in the city. May 1st is the start of Stroke Awareness Month, so definitely wanted to kind of share that also. But a lot of our focus is around improving access to quality care, ensuring that people are receiving, educational, informative resources to really make the best decisions when it comes to physical activity and their diet and things like that. And then one of our major campaigns and initiatives is really around a nation of lifesavers to ensure that at least one person in every household is trained, confident, and comfortable around performing hands-only CPR. Sadly, 9 out of 10 individuals who have a cardiac arrest outside of a hospital setting do pass away. So knowing and being trained and comfortable and confident hands-only CPR can potentially save a life. Anything like that, Said?
Oh, I mean, Jay covered for the most part what we're trying to do. We're currently working on an initiative across the city in which we're trying to work with different community-based partners to get folks certified. Because we also know that one of the barriers to access this kind of education is language. Language access is a huge thing. So we're working with different partners across the city to ensure that if, for example, the top 10 most spoken languages in New York City, we are working with partners who have people that speak those languages so that they themselves can take that resource back either into their communities or into their families to ensure that hands-on CPR is something that can be taught.
Talking a little bit now about menthol cigarettes. Obviously, we think everyone is familiar with how deadly and harmful cigarette and smoking is. Sadly, still and unfortunately, nearly 600,000 adults in New York City still smoke. And in Brooklyn, almost about 100,000 smokers use menthol products, menthol cigarettes, making it the second highest borough, only slightly below the Bronx. And unfortunately, nearly 200,000 children are affected by secondhand smoke each year. So still a prevalence really across the whole city. Wanted to share just a little bit of information around how the tobacco companies and industries are just really targeting families and our youth in the city. Sadly, $8 billion are still spent each year in marketing and advertising of these products across the whole nation. And in the New York City media market, that number is closer to about $160 million. Research has shown just how addictive and harmful menthol cigarettes are to really get individuals to start and youth to start smoking. And the annual healthcare costs in New York State directly caused by smoking are $9.7 billion. So there's definitely obviously an impact to all of us, even us non-smokers. And that's why we're here today to talk about Intro 1152, introduced by Councilmember Rita Joseph, which would restrict the sale of menthol cigarettes in New York City, and also flavored nicotine pouches, which have really become an increasingly growing market share really across the country. I just wanted to highlight that this policy and legislation also really reiterates the agencies that implement this policy and the direct role, if any, of NYPD for tobacco control policies, and really highlights once again that the American Heart Association and others do not support the penalty, use of, and possession of for youth. And so mainly this bill would really go after retailers and harmful kind of actors that continuously sell these products. And then this slide just highlights some of the kind of community and national partners that have come out in support of this policy. So really just wanted to highlight a few of the next steps. If your community organization is interested, we do have the No More Menthols Coalition. It's a coalition effort that's really, involved in the community and engaging the community really about just how harmful these products are. If your organization, like tonight, is interested, we can do a presentation either virtual or in person, and we can provide, education and awareness materials in various different languages to be helpful. And we'd love for every individual to really let their council member know to support the legislation, and we do have resources available, templates, so forth, that can be shared to really highlight the importance of this work. Oh, that is the last slide, actually. I thought there was one more, but just wanted to kind of highlight once again, if there's any resources that are needed from the American Heart Association in our efforts to address heart disease and stroke, and really our efforts to improve access to healthier foods, CPR, and then also this work around really ending tobacco and vaping use. We greatly would love to be a resource to Community Board 7 and all the residents here in Sunset Park.
Thank you so much for that presentation, and we'll open the floor for questions, and I will start with the questions. So what are the key strategies for the No More Menthol campaign to raise awareness about the danger of menthol cigarettes? The main strategies.
Definitely. I think there's still a lot of community engagement and outreach that needs to be done. In many ways, sometimes I think for individuals who maybe are non-smokers, you just lose sight of just the amount of individuals, especially our youth, being addicted to these harmful products every year. And so I think that's one of the keys for us, is really to kind of engage the community in new and maybe non-traditional ways to really highlight how important this is. And also highlight just how addictive these products are on the short and long term. And so in New York City, there's been a lot of great work done to kind of in tobacco control and provide cessation resources, but really our kind of fight right now is around menthol. So I think it's really about providing community groups kind of boots on the ground with the proper tools to really engage individuals and really kind of, get them more involved. I'll pass it.
Yeah, just want to add to that. One of the things that I've noticed, I've done a lot of work in the Sunset Park, Bay Ridge area, Gowanus over the past year, and you'll notice that a lot of these schools are located next to like grocery stores, bodegas, and oftentimes there's marketing at the bodegas that is targeted at youth. So, and these kids are frequently using these stores after school. They're hanging out, they're getting food. So they see stuff like that, and this marketing material is specifically designed to be predatory to ensure that, more and more people are able to, access it in a way in which they're like, oh, wow, this looks cool. I want to be able to see what this tastes like, or or, it looks cool to be able to do something like that. And it's not just a issue that's, stemming in the three areas I mentioned. It's all over Brooklyn, all over Queens, all over the Bronx, all over the city, basically, where you'll see these bodegas that will have marketing that's paid for by these big corporations, and it's specifically designed to be colorful so that more and more kids are able to access it.
Hello. Sorry if this question sounds a little funny, but like menthol cigarettes and regular cigarettes, I don't smoke cigarettes, so I don't know. Are menthol like more harmful for your body, or is it just as harmful like as regular cigarettes? Like, is there more chemicals in menthol?
There's an addictive nature to the menthol that kind of hooks teenagers. And so in many cases, many of the flavored products have been banned and restricted. You're thinking of your candy flavors and kind of things that fruit flavors. Unfortunately, one of the products that had not been is menthol. So it's a kind of a soothing, calming sensation that is less harsh. And that's the purpose of it. So if you're a 16, 15-year-old, and we know of even younger, using these products, it kind of soothes kind of in many ways, which like a more traditional combustible cigarette would not. And so I would have to double check some of the exact research, but it's kind of the addictive nature to it and the soothing nature of it that really does that.
I agree with that. I think the flavors, the menthol, they target like a younger audience, and I agree. Should we stop?
Picking up on that question, are you organization or that's this specific campaign is doing anything with schools such as like charter schools or any schools to raise awareness among students, which are the main target pretty much?
So we do have our school engagement team at the American Heart Association that works very closely with schools. I don't know which specific ones in this neighborhood and community, but we can get a list of which schools they do work closely with. Historically, that's been programs like, which most people know is like Jump Rope to Heart. That's kind of expanded outward and does have a whole kind of vaping and tobacco kind of component to it. We definitely like to work closely with schools to the best of our ability on this coalition effort. But from the Heart Association, a lot of those efforts are through our school engagement team, but we do provide many resources to be helpful as possible. And one other resource, for us to be helpful is if you have questions about the resources you are providing students and youth and families around education and need to kind of double check it or see what is, kind of considered the best practices, we can always, reach into that kind of toolkit also to be helpful also.
This is more of a curiosity. Jake, I addressed this with you before. We previously had a presentation, which was an anti-smoking presentation. This one is an anti-menthol cigarette presentation. I was joking with the previous presenter that the state seems to promote smoking pot. Why is this done so piecemeal? Why isn't it just an overall campaign? It makes me think of an anti-drinking campaign that just focuses on wine.
Good question.
Yeah, so I think there's a reality, and I would have to double check the science and talk to our colleagues about the Lung Association that no smoking is good for any product. Yeah, for your lungs. So we would, have to double check that. I don't want to be on the record necessarily, but, no smoking is good.
Yeah.
We don't, and we believe also, there's no safe tobacco product. When it comes to kind of the legislative side of things, sadly, we do have to kind of piecemeal this together over time. It's not been a kind of quick, clean kind of brushstroke, right? I think in the perfect world, yes, right, that would have been kind of what happened, but unfortunately, it isn't what happened. Some of that's just because of code and things like that. But, in many ways, the opposition to these efforts is real and funded by an industry that has, deep pockets and has made it tricky over the years. So when it comes to smoking as a whole, obviously not supportive of that. It is unhealthy. And I think unfortunately, we've had to kind of piece this effort together over, I mean, probably over 30 plus years, to be perfectly honest, when it comes to things like secondhand smoke and, smoking indoors and just many efforts. It's not been as clean, kind of clean cut as we probably wanted it over time, but this is kind of where we find ourselves.
Yeah, and I would like to add that one of the other things that we need to keep in mind is just how like every industry is innovating in some capacity. The tobacco industry does the same thing. We had, we're talking about like you mentioned patches, flavored cigarettes, menthol, you had e-cigs, now you're able to purchase, marijuana and other products from stores that wasn't the case like a few years ago. So like every time we fight back, there's something else that we're fighting in the process. And that's why it makes it seem like why are there so many different organizations that are involved in this fight? But like one of the things that Jake hit at right now is that the industry that we're going up against is an industry that's pockets are not just deep, but they have lobbyists all over. And we're not just talking about within like the federal government, but also like here and within the city. Like today we had our lobby day where we actually were down in Manhattan to talk with city council members about this specific bill, and so many of them are on board. But you would think like this is like a easy like, oh, 1 2 3 we can get this done, but there is still pushback within communities about this. So we're trying to figure out the best ways to navigate this, which is why it's important for us to be able to build coalitions with different groups. We mentioned our school engagement team. Our school engagement team isn't just involved in like this process, but they're also doing like CPR work. They're doing work in nutrition security. So, it's always just trying to figure out who are the best people that will help represent the fight that we're trying to take to these organizations and to make sure that, New Yorkers are able to live, healthily.
Thank you. And I just want to say, we only overlap by a couple of blocks, but Rita Joseph is one of our council members.
He's a huge champion of ours.
Can you repeat the number of the bill? You say intro. What number is the bill?
Bill is 1152. It was introduced by Council Member Rita Joseph. It has a growing number of co-sponsors kind of throughout the city. But yeah, we are still looking to kind of build support for it in many ways.
I happen to know if Council Member Alexa Aviles and Council Member Shahana Hanif are supporting this bill specifically, or they're not sponsoring this bill? And Susan Swan too.
So we actually did meet with Councilmember Hanif's office today, and they are in the process. They're talking through it right now. So hopefully we can get them on board soon. We also met with Councilmember Aviles as well today, and her office is aware of the bill, and they are also like in the process of going through it because it's also budget season. So we're trying to ensure that if these things are happening, that these things all happen at once. As for the other council member, who was it that you mentioned? Avila's, Hanif, and Susan Zhuang, right?
No, but we would love the, support in reaching out to those council members and, at the very least, connecting them to the work that we're doing. Some of them, I believe, two of those three have previously supported kind of similar like-minded bills around tobacco and menthol. So we would, continue to love the support, love the connection to kind of, make our case in many ways.
I will definitely be more than happy to follow up with this. I do agree that this legislation is important, and given that our three council members, Susan, Shahana, and Alexa, are part within this district, so we would like to get involved personally. And I feel like if a letter of support from the board will help, we are more than happy to push for that letter as well.
Definitely, we can follow up with kind of some resources to kind of help you or draft any language or, you know, anything that is needed to help reach out to those council members. Please do not hesitate to ask.
Right, so that's something what we can talk offline. And I would like to move with the next question. And what is the biggest argument against this bill? Like, what is the concern from some council members and from the public in general?
I think that you hear two kind of, one is the argument of, and I think as you know, there's quite a few obviously individuals who are non-smokers, right? Of, well, this doesn't impact me. I don't smoke. And I think, you know, we see the healthcare costs, secondhand smoke. Even, you know, there's an environmental concern with cigarette butts from, you know, a lot of individuals and organizations. So there's obviously a direct and indirect impact, I think, for non-smokers. You know, another argument sometimes that we do hear is from, you know, retailers who are, you know, concerned about the potential loss of revenue. And there's quite a bit of research out there published that that is just not the case. There will not be a loss of revenue. And I would say those are the primary two that we hear about. You know, there are some concerns about, you know, potentially, implementation and enforcement, and just want to really reiterate that is not done by the NYPD. That is, you know, done by, I believe it's done by,
So I think the way the bill is written, it would be done by the Department of Health. So similar to how restaurants are inspected by health inspectors, it would be something similar of that vein. I know there's some hesitancy from folks when they hear about enforcement. The automatic thought is the police are going to be involved, but that's not the case in this bill. And it's actually, if you go online and take a look at the bill, it explicitly states that as well. But it would be the Department of Health that would most likely be taking a look into that. And in terms of like penalties and everything, I don't know how that would operate, but it was always something that the Department of Health was going to be the main primary people that would be helping, helping with the ban.
add that the penalties are for the retailer. There's no penalties for youth, and there's no penalties for possession. It is for the retailer selling the products.
And from the council members that you spoke to, and the ones that are opposing to this bill, like specifically that they told you already, like, I'm not going to support this bill, what are their main arguments for opposing this bill?
A lot of our efforts right now have been kind of getting it more in the forefront. We haven't received a tremendous amount of pushback or lack of support. It's mainly, you know, a lot of what is, you know, it's budget season in New York. There's, you know, quite a bit of happening, you know, many levels in front. So I think it's about making this more in the forefront around, you know, public health and the impact it has in our communities, and not necessarily a pushback from council, but more kind of, you know, adding kind of some speed to it, so to say, and kind of elevating the issue in many ways to our decision makers and elected officials.
I think for the most part, from the council members that we have been able to speak to, they are supportive of the main idea of the bill. I mean, they obviously all have questions, and you know, we try our best to answer those questions. And you know, obviously, we haven't heard any kind of like negative feedback with regards to the bill itself.
How many people are co-sponsoring this bill at the moment? And when it was introduced, do you have that data too?
Yep, so it was introduced at the end of December and of 2024. Yeah, we're in 2025, correct? Yeah, it's 2024. As of this morning, we're at 15. We do believe there is a decent amount of council members, let's call it 5 to 10, that we really just need to kind of continuously get in front of to elevate the issue, that will co-sponsor it. And our goal is to just kind of keep building it and building it. So we don't have a cap number or anything like that. We just want to keep on building it and building it with our coalition. And you know, kind of coming out to meetings like this and really across all 5 boroughs, just to kind of keep building and building the efforts.
I think one of the issues is not co-sponsoring. I think the issue is more about bringing the bill to the floor for a vote. Are you engaging in any specific um, like lobbying at the committee levels? At the jurisdiction is this part of the health, right? The health committee, I'm assuming. Are you lobbying in that specific committee to bring it to the floor?
Yes, we were at City Hall earlier today, out there meeting with council members. We continuously share information and have partner organizations reach out to the committee and to their council members. So we are 100%, engaged and involved in reaching out to council members. And we have partner organizations, both national, regional, local, doing the same. So yes, the short answer, yes.
To add to that, it's not just the council members themselves, but we're also in touch with their staff as well on a consistent basis.
Right. Like I said before, I feel like doing a community board, community initiative, and trying to push from the community board within the districts. Like, for example, in our case would be Aviles, Shahana, and Susan Swang. And like our neighbors, Bay Ridge or Parslope too, you can also engage them. And I think having a push within the district might be a helpful strategy. If not, if you've done that already, or if you're planning to do something like that.
Where we've seen the most success is in district pushes. Have we, obviously, we want to do more in Brooklyn. I think some of our most success with that has been probably in, I would say maybe the Bronx and parts of Manhattan. But that is kind of the goal, to have constituents and their voice heard and their stories told about why they support these efforts, and not necessarily me or Saeed, but really the whole community. So that is really the game plan and the goal in all of this. But we also, want feedback on how we can best do that in many ways and make sure that we're in the proper places and having the correct conversations.
So from our committee, I think the best way to approach this is to bring this to the general committee and to general board and try to get a letter of support. And we will be sending this letter of support, if approved by the board, to our main 3 council members, asking for support and co-sponsoring of these specific bills. I think that's one of our ways to helping to bring this legislation to the floor, pretty much. No problem.
Appreciate it, and any help we can be, and we look forward to hopefully working closely together.
And any other questions in the chat? Any questions on the room? No questions? With that, thank you so much for coming today and presenting, and we will be in touch. Thanks so much.
Thank you.
All right, so with this, we will conclude our meeting today. And thank you so much, everyone who joined us online and in person for coming, and our presenters as well.
Thank you. Good night.